this, huh? Oh yeah.
This should be everything.
This is limited edition. This is only for our special. First 354 on YouTube.
Oh yeah.
He is doing good. It's like, what's going on here, Cassidy? He's got blood coming out of his arm.
We've placed an IV catheter so that he can have intravenous fluids throughout the surgery to help maintain his blood pressure, as well as give us vein access if at any point we need to give him any extra drugs, if his heart rate drops or anything like that. And we also give him IV antibiotics to help kind of lower the risk of infection, since we are doing a surgery that we're going all the way through to the bone. It kind of raises the risk of infection, so we try and be really proactive by doing the IV antibiotics as well.
He was real nervous, I noticed, when he came in this morning, but he looks more chill now.
Yes, he was very nervous, little Toby, but he had some pre-meds, which is a combination of pain medicine and sedative medication to help him relax, so we were able to get his catheter in, as well as get some pain meds on board before we start anything painful to them. So if we can get ahead of the pain, it's a lot easier to control the pain for them.
What kind of surgery is he having?
Toby is having a combination of a cruciate surgery. So he tore his CCL, which is the same thing as an ACL in humans. They just have slightly different anatomical terminology for dogs than humans. So he tore his cruciate ligament, so he's going to have that repaired. He's going to have what's called a TPLO, which is a tibial plateau leveling osteotomy. And so they will actually go in and cut the bone and change the angle of his tibia, so there's not as much strain on that ligament anymore. He also has a luxating patella, so his kneecap pops in and out, and there's a strong possibility that that will need to be corrected as well to keep his discomfort under control. So Dr. Hoch will evaluate that when she gets in to surgery and correct both if needed. And that leads also, Cassidy was talking about the risk of infection, and anytime you put an implant in, there's a higher chance of infection possibly as well. So again, like Cassidy mentioned, just kind of try to be proactive with the antibiotics and prevent infection. So he'll have antibiotics before surgery and during surgery, and then of course he'll go home on antibiotics as well. Alright, so normally at this point we would go ahead and proceed with what we call induction, which is where we would give him an anesthetic agent to make him get sleepy. But we are waiting for Dr. Hoch and Christy, and we're not 100% sure what time they're coming. They had some other surgeries today and we haven't heard from them yet, so we're going to give it a little bit more time before we put him fully under anesthesia.
able or willing to travel to go for specialty care. And the fact that we're able to come out here, we're able to help families and their pets get some of the advanced care that they need, or to help them just have a better quality of life and better mobility. So I'm really glad that we're able to provide this service to people that can't always travel to those.
I really appreciate that we're able to do this procedure here in Danville, because Dr. Hoch's a specialist, and it's very convenient for people to be able to stay in town and have this specialty surgery done here. And also, people know us, and we can do all the aftercare, and we have all the communication, so they can come visit, you know, the day of surgery and so forth. So it's just very convenient, and it's a great service. So. Did you find your size? Karen, are you one of our original YouTube subscribers?
No.
Alright, you get a t-shirt. You get a t-shirt for that.
What size you wear? Hold on, I have the increased chicken on my
Karen,
though.
Medium, okay. These are all small. You're medium too, right, Jenny?
Depends.
I know, it depends.
Why don't you just get a new battery?
Sounds easy enough. I don't know. My watch, so we forget
I
this
didn't
time.
even see you go and get it.
I brought it in with us.
Is that helpful?
Shouldn't be, but I mean, patients, when you get closer, it's not great. So he's officially recovering now. He's off of anesthesia, and we're just waiting for him to kind of wake up. His little knee's been bandaged, and I've done a cold laser therapy to kind of jumpstart the healing process. So he is all good to go. I'll be sitting with him until he's more awake, and we'll take his tube out, and then he will stay on in his little warm bedroom to make sure that his body temperature is regulating, and we'll be all set for today.
It's 200. One to have to have fix a little one up and help. Huh? And I don't need any help for this one. Okay? I don't need help for this one. You could think of fartlek, but you couldn't think of intervals.
Because I don't do intervals, I do fartleks.
Stop. Dr. Smith, that's not how you do it.
Who decides how you do it?
Everybody clap your hands.